How's it going, guys? Good evening. My name is Jordan Kalmowitz from Eyes on New Jersey News, and tonight we're conducting an interview with RJ Harper. RJ, how are you?
I'm doing well. How are you this evening?
I'm doing well, sir. Thank you so much for joining us. I really appreciate it tonight. Yet again, I'm having the same kind of issue, but I'm just going to forego it and just have the conversation, and hopefully it'll just work out.
Okay, sounds great.
All right. Thank you yet again for joining us. My name is Jordan Kalmowitz, and welcome to Eyes on New Jersey News. In
Thank
tonight's episode, obviously, I have the RJ Harper, Mr. RJ Harper, an environmentalist, a filmmaker, and a man of many talents. Tonight's episode is going to be a little different in the sense where we are streaming remotely due to this tragic situation that we are all dealing with right now. So, RJ, would you like to introduce yourself? Kind of let the audience know exactly who you are and maybe some details like that. I think maybe RJ dropped
uh,
off.
Hear me now?
Oh yeah, perfect. Hey, how you doing?
Good. Okay. So thank you for having me on the show. I'm so happy to be here. I really like what you guys are doing with Either New Jersey, and I'm happy to be a part of this. I'm happy also to talk about a lot of the issues that are happening here in New Jersey related to COVID-19, and the particular interest is just to talk about the recent notification from Governor Murphy about the opening up of New Jersey. Wanted just to get a chance to talk a little bit about the impact of COVID-19 on the African American community here. And so to get an opportunity to talk just about the lack of transparency, I think, that's going on with regard to the impact that this has had for people of color. For me, I think as a filmmaker, as a media person, trying to really get the message out there about how people can do better with regard to how they're really dealing with this pandemic, particularly in the African American and African communities. It's very important that people really get good information.
Absolutely. And full transparency is something that I feel like everybody is looking for. You know, everybody is looking for answers and some sort of direction where to go in or what we're doing. It's kind of we're at a standstill and things are still kind of in that hiatus situation. You know, it's still paused and we're I feel like the general public is really looking for answers at this point. You know, there's so many questions, there's so many different things that people are hearing. News is saying one thing and pushing people in one direction and another direction. So yeah, I like to get maybe your take from an environmentalist point of view. I guess my first question would be, how do you feel like that we're handling it? How do you feel like Governor Murphy, has he been transparent enough with the public? Has he been kind of there for the people? What are your thoughts on that?
Well, this is a global catastrophe, so I think if you look at what's happening globally first, just about how bad this has been, then that really becomes a benchmark for you to be able to look at how the state of New Jersey, and particularly Hudson County, is doing in this whole issue. Um, New Jersey has been hit very hard by this because we are on the perimeter of New York City. So for communities of color, this has really been something that has come as a bit of a shock. And as an NAACP representative for Hudson County, um, trying to get our arms around, the idea that certain communities have woken up to the idea that this pandemic has really, devastated our communities is something that has left communities scrambling just to figure out how to potentially move forward. As it goes to the state of New Jersey, we've had about 6,000 different, sort of problems with people dying, infected, and things like that. And so it's a problem in the sense that people don't really have a lot of good information about how you get infected, the tracking of people who are infected, the stigma associated with being infected. Those things haven't really been fleshed out, particularly in the Black and Latino communities, well enough for people to really get a handle on how do we proceed going forward. So it's a global catastrophe without a doubt. And when that happens, communities of color are disproportionately affected by the problems associated with issues of economics, health disparities that have been longstanding issues in this country.
Absolutely. And I couldn't agree more. The global issue is just, it's right here. You know, it's not just something that's affected right here in New Jersey.
Sure, right.
So something that you did touch on that I really like that is a big issue is the stigma. That's something that not a lot of people are talking about. And I feel like maybe if we could shed some more light on that, maybe to our viewers, kind of explaining exactly what the stigma might be, and therefore maybe there's some sort of solution or some sort of way that we could come up with an idea, or not an idea ourselves, but you know, maybe an idea that would implement in the future that kind of prevents a stigma like this from happening, so people can live their lives safely during a pandemic like this.
So, because this is so new as a disease that has affected the planet, there's been a lot of conversation about, you know, where do people move forward if in fact you found yourself infected with COVID-19. And there have been cases of people who really lost a big part of their life after having tested positive for COVID-19. And I think that as people begin to think about for themselves, you know, the lack of information that many people have about whether or not they can infect other loved ones or other persons around them on their job, that is still a bit of an open question. There are some conversations about the extent to which people are still potentially infectious. And I don't think a lot of people have gotten a lot of good guidance as to, you know, just how to proceed with along those lines. And now, you know, the governor is opening up the state of New Jersey for people to get back, right? So there's historical data that suggests that if you look at the influenza from 1917, there's a lot to suggest that they're making a very big mistake. And this is a pandemic similar to kind of like the flu outbreak of 1917, when they didn't really have a lot of ability to understand what was going on, and a lot of people got infected and a lot of people died. A lot of people died unnecessarily because they didn't have good information. So here we are again, where we can learn from history that if we do things slowly, people are not going to die. Opening this thing up has huge implications for communities and elders and seniors that are affected by this. And so I think when you look at the mistakes that were made in 1917 and 1918 in this country during the influenza problems, the pandemic of that time, you'll see that there's a big part of lessons that could have been learned that I'm afraid we're not learning those lessons, or we're not looking at history to guide us in this way. Going slow during a pandemic, opening up slowly, has always been the better strategy. And despite the pressures that we're having right now from many people wanting to open it back up again, the reality is that they really still just don't have a good handle on this particular disease. And so by opening it up, it's my personal view that there's this sort of, you know, Darwinian approach to how they look at this, in the sense that I think they're kind of just viewing it as, if you live, you're supposed to be here. If you die, we learned a lesson that, you know, you died unnecessarily. If you go out there, there's a possibility that you could still be infected and you could die. And if you look at some of the counties in New Jersey where you have zero recoveries,
Yeah, that's
up, right, tells you that in those counties, right, people who go back out are going to get infected and they are going to die. So no human life, right, is worth the money that, you know, they're trying to get going with this economy, in my view, right? But as
absolutely.
politicians, they have to use their best judgment in trying to figure out what's the best way forward. And in my opinion, and the opinions of many other people in this matter, there are communities that will be disproportionately affected that should not be part of this whole thing. And I think if you look at the examples, for example, of, you know, what happened in the state of Georgia, you know, Georgia opted to open up barbershops, hair salons, and nail places, right?
Yep.
There's a slight hint, in my opinion, of that being something that would, particularly in a state like Georgia, where you have a very large African American community, it's going to disproportionately affect African Americans just by virtue of that particular demographic of people who are going to barbershops and hair salons, right?
Absolutely.
So they're not talking about, tennis courts and golf courses, right? To open up first. And I think that when you look at even the state of New Jersey, like they're not talking about opening up golf courses right now, for the most part,
No,
right? So,
no.
so that's a little bit of a problem if you begin to analyze, like who are going to be the Darwinian losers, right,
Right.
in the social experiment, because as you begin to look at, where this thing is going, I think that they really don't know. They don't know what this virus is all about. We have some pretty good ideas of how things work, but the level of infection is going to go up and people are going to die, and that's just not right.
Absolutely. I couldn't agree more with you. Especially bringing your point back with the Spanish flu and the influenza, how we learned kind of to wait a little bit and then open things up. And I think we should use history, which is always a tool for us, in the learning process. We always seem to try to learn from history. It doesn't always work out well, but we should learn from the history. And with
Right.
that being said, I couldn't agree with you more. I mean, I feel like it's a waiting process and something that we just, I don't know if Murphy wants to do that at this point. I feel
So
like he wants to open things up and kind of do that, but he's also very, controlled about it too. I think he does regard people, and I think he is doing a good deal of help in that regard because he really has come together and really tried for his people, our residents of New Jersey. In my eyes, that's how I view it.
gotcha.
But yeah, like it's kind of like, what do we do? Where do we go from here? I mean, the kind of like you said, I mean, and everybody else has said, this is a new thing. We don't know what's going on with this. We don't know the implications of health, the repercussions that this has, even on the people that recover. We don't
Right.
know what they're, we don't know the actual scientific research on the people's lungs or other issues or organ failures or whatever they might have in the future. Like, this is a huge deal that we're taking a huge chance on being like, hey, the economy has stopped for so long, but it's more important that we get things going rather than opening up in a recession. And I get that to a certain extent. I agree, but human life is worth more than any amount of dollar that you can make on the economy, in my eyes. And
Right.
that's the way that I view it.
Yeah. So I agree with you on that. I mean, I think if you look at other countries who did a much better job, right, of dealing with this, they have a different framework to deal with. America is looking, very embarrassing right now, just with the way that this administration has handled this. We have the worst numbers, you know what I mean, across the globe.
Yep.
We had lots of warnings about this months in advance. They closed the country in preparation for this. So, back in January, we knew about this, right?
Right.
Pretty well. We have a CDC who offered help to China, right? When they were going through this, as if they had the solution and the answers to how to deal with this, right? And then, in America, we appear to have just completely dropped the ball,
Absolutely.
with regard to this. It's devastating our, New York City EMS departments. It's devastating the police departments. You have 700 plus, I mean, it's more than 1,000 now, of, New Jersey officers who have been infected. That also probably means many members of the families. And
Absolutely.
this could have been completely avoidable, had there
Yep.
been better management and better leadership with regard to just understanding how significant this pandemic would be on communities, and particularly as it relates to the African American and Latino communities. Our communities have been disproportionately affected by this. So, there's a lot of real pain and suffering going on in these communities where people are left with a lot of questions, and not a number of good answers.
I couldn't agree more. And even the prison systems, wow, I can't even think of the word. The criminal justice system is completely skewed as well. I mean, not letting out inmates, people were infected, like nonviolent criminals were not able to leave right away. I mean, that was just a poor way to handle that as well. And that also affects a lot of that community as well, and the entire global population, or not global rather, but in our country, that really affects a lot of people. You have sick, dying people in a prison, and some people, are non-violent offenders that are sitting there and now getting this terrible disease because they're stuck in a population with a bunch of people, and it's just spreading like no other. It's just insane. And that really brought light to me. I was like, wow, the way that we are handling the situation on that form, the planning of everything that we had spoke of months ago, when we were first planning on doing this episode. And increasingly got worse. The planning has just been so bad on our account. Like we said, you know, and you touched on this before, we knew about this a long time ago, and we chose not to take action on it. You know, we chose not to be premeditated in the sense of, hey, we need supplies, ventilators, PPEs, we need masks, we need the people, we need the room, and we didn't do any of that as far as that planning.
Well, yeah, and because you brought up the issue of the jail systems, I mean, I think if you, as a media professional as well, you know, think about how many times have you seen on CNN or Fox News, right? Conversations about, you know, the numbers of people dying in federal prison or in state prison, right?
Right.
I mean, you know, the shutdown from the mainstream media of the devastation that is happening in our jail systems is a conversation that should be a big part of, you know, just why this is happening. Because like you said, if you're a nonviolent offender and you end up getting COVID-19 in jail where you have medical staff dying and you don't really have the medical resources that you need, you know, something like this could be a death sentence for something that you didn't do that would have been a death sentence for you, right? And just
Right.
based upon the way that the jail systems work, some people are definitely not going to get out. And I've actually posted some videos of, you know, like some federal institutions that have really been on, you know, like the verge of rioting, you know, and riots that are going on. You won't see that on the mainstream media, you know, and those are the other parts of this major conversation that are having that disproportionately affect African Americans and Latinos, because, you know, no one's talking about those things, you know. So when you talk about opening this back up, there are real implications for people to understand that, you know, this will result in, you know, the kind of devastation that many people are not used to seeing. And I think, you know, we'll look back and know that we could have done better. And had we been more inclined to look at the history of pandemics in America that we talked about earlier, you'll see that some of the mistakes that were made back in 1917 and 1918 are the mistakes that can be avoided if we just look at history. And so, and it will tell us that by going slowly, we have a much better chance of dealing with this, and particularly in America because we have the highest numbers, right? We have a reputation for being a first world country with some of the best medical doctors on the planet, right? And those doctors are getting killed, you know, because they're not really familiar with how the virus works in many respects, right? And that has been
Absolutely.
a huge tragedy that all the people on the front line, so many of them are infected. And now we have major medical doctors also dying because of COVID-19 unnecessarily. There was a major brain surgeon who died about 2 or 3 weeks ago in New York City. And in my view, like, you know, those kinds of deaths are a huge drain on the healthcare system. The deaths are unnecessary, but I also think it points to the idea that we don't really have a really good understanding of how this virus works. As you recall, you know, when the CDC first came out with its recommendation to America about the use of masks, they pleaded to the American public that they should not be wearing masks because the mask was supposed to be available
For sick, yeah.
for the medical staff, right?
Right. And sick,
That was
yeah.
the reality of their real deal with regard to them, at least in my opinion, about them not pushing masks on the American public was America didn't have masks, right?
Right.
We had sold in late January, early February, we sold, you know what I mean, millions of medical equipment to China, who then
Right.
ended up turning around selling it back to us. I mean, that's just completely ludicrous, right?
Yeah, absolutely.
CDC got on television telling Americans you don't really need the mask, right?
Yep.
Only in reverse course, right? Once masks became available 6 months later, and many, many thousands of people were already dead unnecessarily, right? Then they're telling Americans, oh, by the way, we now believe, after having managed pandemics around the world for decades, right? We
That
seem
you should wear a mask.
America, right? That, like, now you should wear the mask.
Right. Yeah, it's just crazy.
And so it's completely nuts, right? And the real question is, I think, if you take a step back and ask yourself, like, what is this whole thing that they're really doing here, right? Because the kind of leadership that's being displayed is not first world leadership by any stretch of the imagination. One, the guidance that we've gotten from the CDC itself, right, has been inconsistent, you know. And I think that that many people see these things, and you know, something that could have been a very, very simple solution to this whole issue of masks, right, would have been for the CDC director to just show people how to make a mask at home back in January in anticipation of this whole thing, right? Everybody would have been okay with that, right? It would have been a gesture to the larger community that,
Absolutely.
right, is important, but getting the N95 mask is not the be all end all kind of mask that you need, given that we don't know enough about this virus, and that there are ways for you to protect yourself that can be done at home. You don't need a $40, N95
Right.
mask, and particularly because of the ways in which protecting yourself can be done so easily. Working in communities of color, not everybody can, order a mask, over the computer, the $40 mask, right?
Right. I mean,
We have really taken efforts in our community here in Jersey City to just show people, listen, there's a way you can make a mask at home. If you live in the hood and you need to get a mask, right? You can protect yourself very easily by making your own mask. You can use a double folded a paper towel inside there, make the mask washable, throw away the paper towel. Those are very, very practical solutions to how they deal with something like this that could have been done back in January, which particularly in the African American communities and other Latino communities as well, would have been a signal that, this administration has an idea of how to deal with pandemics, and they really don't.
absolutely. And this also goes too. I mean, we know a bunch of people that have 3D printers, and the capabilities of printing this. So why wouldn't we have them kind of premeditatedly start production on some masks, or helping people out, or say, hey, anybody that has the resources or anything that can help contribute to what's going to happen in the future, we would really appreciate it. There was just proper planning on all regards, and I couldn't agree with you more. I know we touched on Jersey City, and there's something that I do want to bring up, and hopefully we can get a little conversation going. So what are your thoughts on Jersey City opening up parts against the state recommendations?
Well, so Jersey City is having a really tough time with COVID-19. That's a fact.
Absolutely.
And
Everywhere.
we're still waiting for the health department to release the numbers of just how the percentages are working in the African American community. But we don't really need the numbers back to really know that it's a big problem in our communities, right? So that's
Absolutely.
Our medical institutions here in Jersey City are not in a position financially to really fully bear the brunt of what COVID-19 is going to mean to the healthcare systems here. And so that's very, very disturbing for many people. And that's part of the other issue about just wanting to do a broadcast like this, to give people some better ideas about what's happening down at the hospitals, some of the tragedies that we have experienced with regard to just how people think about Jersey City as a city trying to deal with the idea of COVID-19. We're not doing a very good job, one. But I also think that to the extent that the medical institutions here were already financially strapped before COVID-19, right?
Absolutely.
Ability for them to really deal with the pandemic, it's a microcosm of the unplanned nature of healthcare in America. So Jersey City is getting it bad, and the numbers, and this is one of the reasons why I wanted to do this broadcast, is that when the numbers do come out and when the numbers become more available, particularly as it relates to the African American community, I think that it's going to be just typical of what's happened in places like Chicago and other regions as well. The disparities, in many respects, come from issues of just inherent problems in the African American community with lack of ability to get decent health care. Issues of obesity, issues of high blood pressure, diabetes. These are all underlying issues that have taken out a number of African Americans in our communities and in the Latino community as well. But even in that sense, it's my view that many of those deaths are also unnecessary, right? And so what we do in Jersey City and what we've been trying to do is talk to people about things that they can do to just help boost your own immune system, even if you do have underlying health conditions, right? And one of the things, that the strategy that we've been able to do in coordination with some of the agencies that provide healthy lunches, healthy meals to people during this time, has been to try to educate people on just, some things that you can do that are practical, natural ways for you to begin to build your immune system in anticipation of you encountering this virus. Because, Jordan, you're going to encounter the virus, and probably you already have on some level, right? So depending on your level of health, you can do things in the next day, 2-3 months, for yourself to build up your immune system so that you have a fighting chance. And one of the things that I just, try to talk to people about is, if you understand this virus, that people end up drowning in their own mucus, right? Because your lungs fill up with this mucus. And because of that, There are things that you can do as a healthy person or even somebody with a compromised immune system to just lower your consumption of dairy during this period, right? To
Oxytocin. Yeah.
reduce, yeah, to significantly reduce the amount of mucus that you have in your body, to give yourself a fighting chance, or your grandmother or your aunt, to just, listen, get off dairy, right? No eggs, no milk, no cheese, no butter, no ice cream, right? We're just going to, get off dairy and reduce the amount of mucus that you have in your body. So that's a very practical thing the CDC could have told everybody, right? The CDC is not going to say that. Why? Because the dairy industry would, like, go
Take the
bananas.
hit.
Yeah.
Take the hit on the dairy industry. Yeah.
Okay, but you know what? If it's going to save lives, then we're going to talk about it anyway, right?
Absolutely.
But something like that, like something as simple, do you know what I mean, is getting off of dairy, will do significant amounts of benefit to many people in their communities because, in particular, all diseases basically travel through the body through the mucous membranes, right? So less mucus, less disease. One. The other thing that I think is important that people understand is that, there's no real definitive proof that you can't get COVID-19 in your eyes. Your eyes are also mucous membranes. And so despite all of this conversation that people have been having related to, oh, keep your mask on, cover your mouth, cover your nose, right? The
What about
large
your?
my view about some of this stuff should also incorporate people thinking about protecting their eyes.
Yeah.
The
Absolutely.
droplets can fall into your eyes, right? And nobody wants to be the person who gets COVID-19 from having had a perfect mask on, right? Thinking that they're protected on the job, only to have your coworker talking to you, spouting forth droplets, right, all into your eyes, and those are the same mucous membrane, right? Murphy has never said that once. Every single medical professional coming on, right, even the CDC, is not telling people about the possibility even of that being the case, right? And something as simple as just, wearing your glasses or wearing glasses, right, could be a very valuable thing that people can just incorporate into how they think about this virus and how to protect themselves. But these are some very practical things that many people aren't talking about and don't want to talk about for whatever reason. But I think that the more these independent, organizations like yourselves who are doing the media and covering these things in a way that is really kind of grassroots in New Jersey and beyond, will, I think, disseminate and get information out to people so that they have a way to think about this, and the most, and very importantly is, staying away from people, right?
Right. Staying home.
One of the things that I was a little disturbed not to hear from Murphy today was to re-emphasize something that he had brought up about, people staying away from each other by 13 feet, right? Initially, when this started, social distancing was defined as, stay away from other people by 6 feet, right? Then they went
Absolutely.
to like physical distancing for a while, right? Which was supposed to be about 13 feet when they realized that water droplets become something that can even travel farther, right? Um, so those are some practical things that I think should be part of the conversation in the health community so that people can really get um, solid information about just what it is that they're dealing with. I've had the ability to speak to a lot of Asian doctors and medical professionals and other people. And, many people in the Asian community, they've experienced these types of pandemic before. When you think about H1N1,
Right.
SARS, I actually
Hers.
as a filmmaker to work for a while with as a consultant with Homeland Security in Essex County for a while during the Ebola outbreak, and having worked and seen some of the stuff on the inside of what Homeland Security is dealing with, the public doesn't really oftentimes see all of the other issues that are going on related to the way these kinds of pandemics are managed. They the politicians and the healthcare providers, they certainly don't want the public to panic. That's one overriding thing that I think they do a pretty good job of not. But I also think that they could do a better job of just giving people smart information so people can make intelligent decisions. And when people don't have all of that information, then you get people dying unnecessarily. And I think that's the reason why I was very happy to want to do this show, because the practicality, of what we're dealing with here suggests that there are ways that people can avoid getting infected by this virus, and you can still open this back up, right? If there's a reasonable sense that people are going to do their best to just use the information that we have available about this virus and then just be smart about it.
Absolutely. That yet again, it goes back to our original point of transparency. There needs to be more transparency within health and all these other aspects of life that you can kind of help in the future, as far as negating people from getting sick, or kind of cutting the population, like giving us the information that we would need, like you had said, with the mucous membrane of the eyes. You're the first person that I've heard actually mention that, believe it or not. I mean, I've heard doctors and other people like that mention it in quite a few videos that I've been watching to kind of keep up and related to stories, but nobody has come on the news and said, hey, wear protective eyewear. You know, there could be droplets that get into your eyes. I've never heard a mention of that, and you're the first person that has. So, you know, there's things that we can do here that really help us for the future that we're not really implementing, you know. Like you said, a healthier diet with things that you can stay, you know, kind of on top of that help your health, your immune system, boosting your immune system. There are so many different things that you can do at home, you know.
Yeah.
So that's really essential.
So given that we're talking about things like that, like boosting your immune system, right? I'm not a medical doctor, so I'm not
Right.
prescribing, to do anything. What's happening is what you find is that particularly when you look at some of the idiotic statements that the president has made, recently with this whole issue of the Lysol, right? And I mean, like, kind of jokingly thing, like people actually are so desperate, right, for a good answers to some of this stuff that people actually really believe the president, and went out and did some really like idiotic things related to that. But I also think it speaks to the desperation that people have of wanting to get real answers, right? And they expect our leaders to be people who will give a quality response, right, to a disease that we don't really know a lot about, right? So, I mean, if you think about just the practicality of what you're dealing with this virus, there are many things that people can do naturally to just help to boost their immune system, right? What we try to recommend to people, as you think about, is one, apple cider vinegar, right? Okay, so apple cider vinegar is a really great throat clearing vinegar, right? You can do a shot of apple cider vinegar 2 or 3 times a week during this period if you feel like you want to ensure that you're not letting the COVID virus get into your lungs, right? So something as practical as apple cider vinegar, a shot of apple cider vinegar, you know what I mean? Particularly if you're coming home from an event where you feel like I might have been exposed by somebody or something like that, right?
Right.
A week or two to actually get sick. So by doing something as simple as, just a shot of apple cider vinegar, it will kill a lot of the virus that will be in your throat. But the virus starts really in your nose, right? So you can use a neti pot, you know what I mean, to do nasal flushes for yourself if you feel like, I've been at an event where there was a lot of people there. I don't know if I was exposed. I have a good immune system, but I want
Right.
to think about, just being a little bit extra cautious. So you can do a nasal flush for yourself. And what a nasal flush is, you're just, using a solution to just wash out your nasal passages. And something simple like that, right? Although it's not a medical prescription for what you're dealing with, right? Will give you a reasonable sense that you're doing a lot to protect yourself, not to mention that your own immune system will kick in to fight some of these things as well. Something as simple as using lots of lemon and tea, green tea is great, right?
Right. Antioxidant. Yep.
I'm sorry?
Antioxidants
Well,
and
the
ginseng and
antioxidants, but
yeah.
also, but also, no, but also, your immune system is based in your gut, right?
Right.
So lemon juice, right? In the morning, lemon juice on an empty stomach will do a lot to kill a lot of the parasites and other things in your body, as well as even the apple cider vinegar, right? So if you feel like I'm a little overweight, or I feel like maybe my immune system's not where I want it to be, then by doing something as simple as working on clearing out your intestines, right? Will do a lot, because your body's not going to be fighting, right, the other parasites that you may have in your stomach. So if you do things to clear out those things, like lemon juice, apple cider vinegar shots, right, that then begins to boost your own ability to get your gut working right. So that when you do encounter the COVID virus, because many people who get the COVID virus, Jordan, doctors talk about them getting having a stomach ache as one of the principal starters for this, right? So if you have a weak immune system, right, and your immune system's in your gut, and it's not working great, and your gut is not clean, then that gives rise to you having a much more difficult experience with this, right? But that's
Right.
weak before it even gets into your lungs. So
Yeah.
that's when I'm telling you, you can be fighting it. And even before you get it, if you're going to go back out there, right, then at least go out there in such a way that you feel like you have done a lot to boost your immune system, so that even if you are encountering it, right, you can hit it in your stomach, right, you can get it in your nose, right, you can try to find ways to clear it out that way, or that if it gets to your throat, right, doing apple cider vinegar. What you're really trying to do is prevent COVID-19 from getting into your lungs, but it doesn't get into your lungs right away. And that's why so many people who get a little bit sick and things like that can do a lot for themselves. And it's partly the reason why, even with hospitals, they tell you, well, you're not really sick enough,
Right.
Hey,
And they'll refuse you. Yeah.
that's your shot. You're not sick enough, right?
Yep.
So they can do other things. And what I found is that even medical doctors that I've talked to, I'm asking them, I'm like, so you're a medical doctor, you're dealing with people who have COVID-19. What are you doing to boost your immune system? And some of the answers you get are Tylenol. Like, bro, like Tylenol, really? like you think you're going to be Superman? You're not going to get this, right?
Right.
Okay. Right. So I think that some things like this, right, where we put a lot of faith in our medical community, has opened up people's eyes, because the medical community is dying.
Right. Absolutely. Yeah. A lot of our resources are towards the medical community. So yeah, when you see all that,
yeah,
scary. It's scary. So I guess the biggest question is, I mean, a lot of people have the same question, I'm sure, but where do we go from here? What are your thoughts on that? What do we do to kind of, I know that we went over dietary and health and things that you can do at home and things that you can boost your immune system and ways like that. But what is the approach? Like, what do we do as far as with, New Jersey eventually opening and dealing with going back and opening things up too early throughout globally, like how do we know that we definitely have a control on this and we're not subjecting people to get sick and then have a whole reoccurring cycle all over again?
So my recommendation is stay home.
Absolutely.
Right?
Absolutely.
Everybody, if somebody else wants to go out there and die, let them go. Right. My view is stay home, stay home, stay home. Right. Give yourself another 2 weeks. Right. Just like what happened in 1917 and 1918, right? The people that rushed out there first, right? If you look at the historical information of the people who rushed out there first, right, end up dead. Quite frankly, that's what it is. I'm telling you, right? And that's unfortunate, but that's just the reality. And we all know that on some level. We're gonna look back, Jordan, in 2 weeks and be like, a lot of people died unnecessarily, and like we knew that was gonna happen, right? But the reality also is that history tells us that that's going to happen. So for whatever reason, some people are going to do that regardless. I won't be, right, and I don't recommend that other people are, but some people are just a lot of people don't know a lot about this virus, right? They're still learning, and if they want to present themselves as guinea pigs on how this virus works and how you don't survive it, then I think that that's just going to be the reality. Some people are itching to open it up. In an environment where they just don't know. Some people, unfortunately, are willing to put themselves out there as guinea pigs.
Right, yeah, so.
And I think the reality is we'll have to watch them, because I'll be staying at home.
Yeah, it's the wisest advice that you can give. I mean, at this point, I think that everybody should just stay home and kind of take not matters into your own hands, but like you said, and what we've been saying and kind of mentioning throughout the whole episode is really taking care of yourself and learning precautions that you can do at home, that you can take care of yourself. And I think that's a great message to really give to people. If that's something that people can take away from today's episode, that would be tremendous on both of our behalfs, I think.
Yeah, well, I think that nobody should present themselves as a guinea pig. That's the most.
Oh yeah, absolutely not. No.
Use a guinea pig for someone else's agenda, for one.
Right.
But I also believe that to the extent that there are many people who really just don't understand what's going on, then I think you present yourself with an opportunity to say, look, you don't really know what's going on. I mean, we have medical professionals that are still dying right now, right? Don't really know what's going on. So why would you put yourself and your family in harm's way, And particularly for the persons who have had COVID-19, there was no guidance today from any of the messaging about if someone who had been infected with COVID-19, how long should they be away from others before they're no longer infectious, right? Because I think even responsible people who've had COVID-19 want to know, how long am I going to be infectious and go back to work, right?
Absolutely.
And we know that there are stories and real scenarios, right, where EMS workers and police officers who've been infected are being told to come back to work because they're presenting no signs, but they don't have paperwork that shows that they are no longer infectious, right?
Right. Or medically cleared to go back or fit to work. Yeah, there's nothing. There is no
Right.
prevention. Right.
So we're going to learn a lot of lessons from that. I think there'll be a lot of litigation that comes from this, right, about how we could do better. This is, again, the irresponsibility of, the government and the administration in trying to deal with this whole thing, because it's not in any kind of way as if this government didn't have some idea that pandemics were going to happen here, right? We
Right.
should have protocols in place, and particularly because we knew about this back in January. There were so many resources and things that could have been done properly, that because I think, the arrogance of this administration has been such that, we're America. We don't, this is not going to affect us. We shut it down, you know what I mean, when this first happened in China, and that was good enough. And the administration dropped the ball, and now you have a lot of dead people as a result of that.
Absolutely. It's just crazy the way that we've been handling it. And like you said, and we both mentioned, the fact that we knew about this a little while ago and we handled it so poorly, we were just like, you know what, we're the United States. We're not going to get it. We'll just shut everything down. We'll be no preventative measures at that point, and that's scary. That's a scary thought, a scary situation. Look where it's brought us. Here we are. Can't even, you can't even see your loved ones, even if they have a funeral, if they pass, at this point, it's insane. It's just crazy.
So I also think that the mental health issues related to how people have to deal with this is also something that's not gone addressed well enough,
Absolutely. Yeah. The fact that people are self-isolating and the fact that they're in quarantine and people have depression and bad mental thoughts to begin with, and now here they are alone and even more lonelier than they've ever been. It's just and there's not a lot of resources, there's not a lot of talk about it, and that's a big thing that you bring up. Not to take away, I want to hear what you have to say, but I just want to mention the fact that here in Eisen, New Jersey, we're actually partnering up with a company that's a nonprofit called Start Day One that deals a lot with suicide prevention and mental health awareness, and that's something that we're planning on doing, having weekly episodes with Start Day One and their foundation, and kind of bringing light the fact that there are people out there that have been in this state of depression or state of mental health that are not doing well during this time, and I'd like to shed some light on that.
So
I think that's what we're doing.
That's very important. I think that, just again, because I'm here, talking about the real implications of what this means in the African American community, mental health services are critical in the Black and Latino communities at this point. And the stigma issues that are going to be part of this disease going forward are also really, critical. I will say that the New Jersey Health Department has started some initiatives to address some of these very concerns related to the need for mental health counseling, and has established an ongoing organization to do kind of like virtual group sessions, because there are people who ended up getting COVID-19, beat it, and then were rejected by their families because of the inability for the family to recognize that the person may not be infectious, or the lack of knowledge, right, as to when in fact this person is going to not be infectious any longer, right? So there hasn't been a lot of guidance for a lot of people who are trying to be responsible having had this virus, but also then with the rejection, of what that means. What is your dating life like after you've had COVID-19, right? I mean, that's a whole conversation.
Yeah,
another
discussion
they're going to struggle with, right? And I think there have to be some benchmarks put in place for people to understand that there are resources to deal with some of these issues of stigma associated with it. And there are going to be people who are affected by that. I mean, people's jobs, right? Your careers. A lot of Hollywood actors ended up getting COVID-19, and that it's a whole conversation, about just their brand and what that means, and how working with those people will be somewhat changed. The most recent study, which I sent to you guys earlier, suggests that we're going to be dealing with COVID-19 kind of social distancing potentially until 2022. That's 2 years of social distancing, physical distancing, mask wearing, COVID-19, hospitalizations, economic upheaval, shutting down, opening up, shutting down. Because even as we talked about earlier, when they had the influenza epidemic in America back in 1917, they had to shut down multiple times. And I think that's the other reality that I think people need to understand is that this first shutdown that they're trying to institute here in New Jersey will be one of many
Oh
that
yeah.
have to come.
Not
And I
just going to be a one-time thing.
yeah, and the lessons that we're going to learn from the first shutdown are we shouldn't have opened it up
In the first place.
right?
Yeah.
So if that is the case, I mean, the smart money is going to be on. I don't want to be out there, the first responder, right, to this opening because those are the Darwinian test guinea pigs.
Right. Right. And that brings us back to our previous discussion about that. It's just, it's the best solution is just to stay home, and I think that's what the biggest takeaway is. And with all of our viewers, I think what we can take away from tonight's episode, RJ, thank you so much, is really how to take care of ourselves and really stay away and stay home. And that's the biggest thing that we really need to push on people. And kind of like I said, and I mentioned, mental health awareness and letting people who are feeling a certain way, shed light on them and don't make them feel lonely during this time, because right now is one of the loneliest times, I'm sure, for them or people in general. Even people that are in a happy state of mind are still struggling with this quarantine. People want to get out, they're restless. So I think that we need to find a way that really, we can stay home and feel comfortable being at home and kind of taking preventative measures like we talked about. I think that's the best thing to do.
Well, the other thing, too, I think that I will applaud the state of New Jersey, particularly some of the leadership here in Jersey City, have been some, council people really arguing on behalf of the renters and the homeowners affected by this. Because, it's one thing to say stay at home. That sounds great as a soundbite on the media, right? But, there are real financial implications for, wanting to stay home or being able to stay home, And I think that there has been some real leadership with regard to just how, particularly here in Jersey City, how the city has opted to try to work with landlords and with tenants and owners, right, to just ensure that, one, people are not being thrown out into the street, right, because of COVID-19. I think that's a major value of having, a governor like Murphy in office who recognizes that those are some things that he moved on very quickly. And Murphy will certainly get my vote, you know what I mean, for just some of that kind of, right? And just recognizing the seriousness of what this whole has meant for many people. I think that becomes part of the conversation. And with regard to that, I think many people should know that you're not going to be evicted. They're not going to turn your lights off, right? There are food pantries and other options for you to be able to, ensure that you're not starving. I mean, we do a lot of work with our seniors here in Jersey City to provide them with healthy meals that we distribute every Saturday in Jersey City to the tune of something like 1,300 people through the BITE organization. So we're America, we're strong, we're going to get through this, stay healthy, stay home, right? We're all having to, rethink so many things, but it's really important that we just spend a lot of time ensuring that, we all get through this, right?
Absolutely.
We all try to learn as much as we can about how to protect our loved ones, stay home, right? Eventually they're going to figure some of this out and there'll be a pathway forward that will be reasonable for many people. But I think that particularly for people who feel a need to just want to, just learn that, like, I don't want to jump out there and be the first one out there, right? That is, I think, the important reason why people should, just think about just staying home. It's, it can be a few more weeks, but that will be a determinant, when the numbers come back as to what's happening, because we have not tested enough people in New Jersey.
Absolutely.
America, if we were testing, 1 million people a day, we would have a much better sense of the level of infection here. And we're not doing that even by
not even close to that number. Yeah.
Close, right. So with that being the case, they're still trying to figure out so many things.
Right.
Absolutely. And testing will give you a benchmark about this because, the problem is you're going to go to work. Many of the people are going to look like they're okay. They've never been tested. And they could be infecting people and not have any idea.
Right. They could be the host of it and not even know. So,
right.
Yeah, it's just, It's crazy.
Yeah. So those are some things about, just trying to get people to recognize that there's so many variables out here that people just don't know. I mean, the other thing, Jordan's, they haven't even really gotten down to a fundamental understanding of where this virus came from, right?
Right.
I mean,
That's a huge,
feel
yeah.
comfortable? Do you really feel comfortable that COVID-19 came from the wet market in Wuhan?
No,
No. Okay, right. Okay,
no.
nobody, right? Nobody. Okay, right. I mean, so nobody believes that story. So what is the real story? Like, where
Right.
did it come from? What is it, right?
The
Um,
origin of everything, yeah. Nobody knows. Nobody knows the origin. And that's a whole nother topic for a whole nother discussion,
right.
That's
So
right.
with that being the case, but depending on what they've talked about, the story, and there's so much bad information out there, right? But I also think that even the blame game of where this virus came from, it's still that discussion is not over with,
No.
um, and so I think it's important that be a part of the conversation, because we wouldn't have as many healthcare workers who've died from this virus if we understood it, right?
Yeah,
Right, and that's the reality, um,
absolutely.
to the extent that they don't really know how to open this up, right, properly, figuring out like how people actually get infected, right? They're still trying to figure that out, but that's not a conversation that they want to have with the general public, regarding this, right? And at no point, even in the opening up, have they talked about people potentially getting infection in their eyes or their ears or something, right? There's not enough information. So, with that being the case, I mean, if you look at some of the many Chinese doctors who dealt with coronavirus patients, many of them did not get infected, and they had some protocols that they ended up using, which were found to be very valuable. And one of those things is vitamin C. Like high doses of vitamin C, mega doses of vitamin C, particularly the powdered vitamin C, has been found to be extremely valuable, right, in helping to boost your immune system. And it was something that has been utilized to a certain extent, even in New York City hospitals, right? Vitamin C. So they know that vitamin C, mega doses of vitamin C to the tune of 2,000, 3,000 milligrams per day does wonders to give your body the fighting chance to be able to fight off COVID-19. The problem is, particularly here in Jersey City, intravenous vitamin C for COVID patients is not happening at
Yeah.
all. They don't have it, right? Okay, so then we're that's a huge problem, right? But in New York City, some of the better hospitals use those protocols, and they've been valuable, right? So it also just depends on location, economics, people who understand the virus. These types of things are very, very important. So I think New Jersey is going to learn a lot and need to learn a lot. I think that the healthcare community would do much better by trying to incorporate best practices that have already been instituted from some of the Chinese who got over this a lot faster than America did.
Absolutely. I couldn't agree more. So, RJ, unfortunately, with the time constraints that we have right now, we're going to have to try to wrap things up a little bit. I mean, we could sit here and talk for probably another few hours. We could just keep going back and forth.
Really.
And I couldn't thank you more. And I appreciate you so much for taking the time and coming out and really, giving us some sort of direction or some sort of idea and really helping, kind of solidify the idea that there are things that we can do here at home that might help us in the future and things that we can really work on ourselves that maybe we can carry with us and boost our immunity or take precautions to really take a step back and be like, hey, look, this is going on in the world, but there are ways that we can protect our loved ones even more, or precautions that maybe we didn't even think of, like eye protection. That's a big thing that, not a lot of people are talking about. And that was a really, really great topic that you brought up, and I really appreciate it. And like I said, thank you so much again for coming out and taking the
Well,
time.
I love your show. I mean,
Thank you.
saw. I mean, although I probably shouldn't say that I really watched that Weed Man show, but
Well, Wee Man is
you
Wee
guys
Man's shout out, Wee Man, shout out. You're one of the greatest guys, man.
no, but I will say that these kinds of independent news outlets, right, are very, very important, because I think that your fans will find that what you guys are covering is important. And I think that because you delve into trying to really get into the communities, particularly for here in New Jersey, just in what you're doing, this kind of independent media is so important. I mean, Instagram is a way for you to broadcast, locally, nationally, globally.
Right.
And there's somebody on here who probably got some nugget of information about, how to, boost your immune system or just something, right? And it's that ability to work with media organizations like yourselves that I think is going to be a big push to get people to just take this a lot more seriously.
I couldn't agree with you more. I couldn't agree with you more on that aspect, but we'll see kind of what it comes down to, hopefully that we kind of take more precautions on ourselves, and, hopefully people that are watching, hopefully somebody learns something. They take something away from this conversation. That's all that we want. That's all that that's all we really, really care about, is that somebody takes away some sort of piece of information that they didn't know before this. And they're like, hey, I learned this from this awesome episode of Eyes on New Jersey with this really informative person named RJ Harper. So that's what we're shooting for, and that's what we always strive to do, and we appreciate it. We're here to try and make government a little bit more transparent in New Jersey and cover the issues that people don't really want to cover. And I think that's a big thing for independent media like ourselves. And we appreciate the love, we appreciate the help, and we appreciate the support. And we'd love to have you on again. Thank you so much, RJ.
Okay, thanks a lot, guys.
Have a good night. Thank you again, sir. Take it easy. Thank you, viewers. Thank you for watching. It's been another episode of Eyes on New Jersey News. We appreciate you, the viewers. For more information on COVID, there's always new updates coming out. We'll be updating the general public a little bit more as we hear some more things coming out of New Jersey and Governor Murphy. As I mentioned before with RJ, we have a really cool kind of little startup video weekly thing that we have going on called Within Ourselves. That's starting with Start Day One, which is a nonprofit foundation for suicide and mental health awareness. And if you guys can give us a little bit of love on that, we'd really appreciate it as well. It's, there's a lot of people out there that are going through some rough things to begin with before this incident even occurred. And now, with the whole isolation and loneliness, it's really not helping people with those kind of mental health disorders and disabilities. And we really kind of want to shed light on that. And thank you so much, everybody. This is Eyes on New Jersey. I'm Jordan Kalmowitz, and I bid you adieu. Have a good night.